Things were quite different 25 years back when I did my first hair transplant. There was hardly any knowledge in the common domain about hair loss, hair transplants. Clinics would get away by saying anything to the patients and the patients would believe it. That was the situation even 15 years back. Over the last 5 to 10 years in particular, there has been a sea change in the field of hair loss and hair restoration surgery, hair transplants, medications for hair loss treatment in men and women. Each one of you who's watching this video has a colleague at your workplace or a family member or a close friend who's been through a hair transplant. Ask him about his experience of hair transplant in the long term. Is his hair transplant the same as it was 6 months to 1 year after the procedure? Did he take any medication following the procedure? Did his hair transplant continue to wither away as the years passed by? Well, if a long-term hair transplant, a long-term hairline result is what you want, and you don't want a hair transplant that ends up as a damp squib, this video is for you. So we will first discuss today's patient and then go on to how practices, especially my practice, has evolved over the last 25 years. Why hair transplant results before and afters, nice comb through videos is not all you should be looking for while you do your research. There's a third dimension to it and we find out after this result. And now this is a young Indian male who came to us for a hair transplant because his receding hairline and temples really upset him. Look at his before pictures. A grade 2 androgenic alopecia with hardly any history of baldness in the family. So we proceeded to do his hair transplant with minimal number of grafts. He has been on medication off and on in the last 4 years that he's had his hair transplant with us. He has been able to successfully maintain his result, maintain a natural looking result. His baldness has not progressed over the last 4 years and he's quite happy with the type of hairline that he's got. Not even his barber can tell that he has had a hair transplant done. So see his before and after results and then we'll come back to a rather mundane discussion, if you may, about how my practice and other practices in the field have developed over the past 2 decades doing hair transplant and managing hair loss patients with hair loss treatment for men and women. So hair transplants are much more than merely mechanically shifting grafts from the donor area to the recipient area without strategies to maintain these results in the long term. There is no hair transplant in a setting of progressive baldness that will last beyond 1 to 2 years. Let me make this point very, very clear. So we need to think of strategies to maintain, retain and sustain this result in the long term. And with long term, I mean beyond 5 to 10 years. And this is the reason why you will not find many long-term results posted on the internet while you do your research for your upcoming hair transplant surgery. In 1996, when I did my first hair transplant, just shifting grafts from one place to the other and making them grow was an ordeal. We thought ourselves to be lucky if all our hair grew, and hair could not be planted in good density. Because the knowledge of hair transplant was anecdotal, there was not so much of published literature and hardly any training programs in the field of hair transplant surgery. The doctors who did hair transplant were very secretive about their skills. People wanting to start a hair transplant practice were seldom let in. I was fortunate in 2001 when I did a fellowship training program in Detroit under Dr. I.N.T. Jackson, an acclaimed reconstructive plastic surgeon who worked out a 7-day training program for me with a local hair transplant surgeon in Southfield near Detroit. And that is how my practice of hair transplant surgery, which many consider as successful, started in 2001. And then the next evolution happened in 2010 when we switched from FUT surgery, the world over almost, to FUE surgery. And now almost 95% and above procedures all over the world are done through FUE technique. You can call it by so many different names, but basically we are talking about generic FUE technique. And over the last 10-15 years, this technique has evolved and the results, when done properly, look very natural. The donor area cannot be made out if the doctor and the patient are not greedy to get more and more grafts, and it has become a safe surgery in most hands. And in the last 7-8 years, there have been many refinements in the technique, better equipment, better skills, better understanding of the process of hair growth, preservation of grafts. And in my clinic, we have bettered in the last 10-15 years our technique of in vivo preservation of grafts, preparing the grafts once they're out of the body in PRP with A-cell solution, and then planting them by the use of implanter pens. This has decreased the out-of-body ischemia time for our grafts at Darling Buds Clinic considerably and giving us better, more natural hair transplant results. The introduction of high magnification in dissecting grafts for the hairline, the leading edge of the temple points and the hairline has been a significant advance over the last 5 to 7 years. This has gone a long way in producing natural results, hairlines that almost mimic nature. The direct hair placement technique, that is minimal handling of grafts, use of implanter pens, I learned in 2007 after spending 3 months with a famous Indian hair transplant surgeon, Dr. Vasa in Ahmedabad. And there has been no looking back. Switching to FUE technique, advanced FUE technique, preservation of grafts through in vivo technique, and soaking the grafts in PRP with A-cell, and then directly implanting them using implanter pens. This is why we get natural results with good density, results that can be sustained over a longer period of time using hair loss treatment medication for men and for women. The third dimension of hair transplant surgery is medical treatment after you get a hair transplant. Without medical treatment in a setting of progressive baldness, there is no way you can retain your hair transplant results, your fabulous hair transplant results, beyond 1 or 2 years. You can ask your relatives, your friends who undergone a hair transplant this, and you will get one reply that without medication, going into hair transplant surgery is a huge mistake. This is a third dimension of hair transplant, which clinics which are very busy, clinics in which doctors do not have the requisite knowledge or the time available to guide the patients over the years to fight their genetics as baldness progresses. So this was the talk for today, and I hope you understood the bottom line that in the long term, retaining your hair transplant result when you have progressive baldness is a huge challenge if you do not follow advice, if you're not compliant to medical treatment. If there is a forest fire, you don't plant trees. You first extinguish the fire and then plant new trees. Only then can they grow to their optimal extent. So that was the message. Let me know if you have any questions, any doubts in your mind about hair transplant, hair loss treatment for men and women. I'll be there to help you. And for those who haven't subscribed yet, please do. Your encouragement keeps my channel growing. Have a nice day. God bless you.